What if everything you thought about disease and prevention and healing was missing a critical piece? What if we shared this critical piece with you today? Would you be willing to take action to get a step closer to the optimal health you desire? Yes? No? Maybe? We'll see. Because today we have the authority here, world renowned, internationally renowned, you can just say board certified cardiologist and internationally, like I said, internationally renowned integrative medicine. And I know that perhaps maybe he doesn't think of himself that way, but when it comes to orthomolecular science, I listen to him. And Dr. Thomas Levy, MD, JD, has written another book. The book is called The Only Cause of Disease. And the tagline or the byline is Healing by Reversing Pathology. What if he shares something today that is the missing link to your healing? Will you listen? We'll see. So today we have Dr. Thomas Levy, and I am challenging you to take as many notes as possible. So get your paper, your pencil, your whatever it is that you like to write on your computer, because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lily McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lily McDermott radio show Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, today I am excited to introduce you to, once again, first time of the year, Dr. Thomas Levy, the first of many times this year. And like I said, the book is called The Only Cause of Disease. And we're giving away, listen to how generous Dr. Thomas Levy is, 26 of his PDF copies of this book in honor of 2026. All you have to do is claim it. You could email me because it's a PDF version, not the hard. If you want the hard copy, then you're going to have to go to his website at tomlevymd.com, and there's a link there that will take you right to the book. But if you want the PDF just to get started, just text me at 407-373-5959 or email me at lily@whenyounneedafriend.com, and I will send you the PDF. Actually, just email me because it'll be easier. I can just, reply to you and it'll be quick, one step. But today we're going to be talking about some of these truths that we may or may not have been told, that they may or may not be hidden by social media and the world that wants to sell you the pill. And I am thrilled because it is our sole purpose in life to give and receive love and knowledge. And I am grateful that Dr. Thomas Levy, MD, is here to do just that. Is here to do just that. I am just so grateful. I'm tongue-tied. Welcome, Dr. Thomas Levy, and Happy New Year.
Hi, Lillian. Same to you, my dear.
Yes. Okay. So here we go, Dr. Levy. We have so much we don't know. And you have written many books, and now you've taken the time out of your busy schedule to write another book. Why did you feel the need to write another book of your protocols, and did you discover something different and new?
Yes and yes. This really represents a cumulative compilation of all the other books and the clinical experiences that I've had at the outset with Dr. Huggins and since then with different individuals around the world. And also, it's hard to know at a certain point in time when something coalesces in your mind, but some things came together, and then I went to PubMed and I said, wow, that really seems to be the case. And this allowed me to, if you will, put everything together and tie a bow on it. Because medicine, of course, in many ways is very complex. But as it turns out, there are some underlying, very straightforward, simple themes upon which medicine is based. Why people get sick is a lot more straightforward than knowing the best way to take care of them. But there are definite common themes on why you get sick, and very simple and very minimal. There aren't that many things that cause you to be sick. And this is what the book goes over in some detail to show that if you follow certain pathways, certain parameters, certain lifestyle choices, that's not to say you're never going to get sick, but you're going to find it a whole lot easier to maintain a healthy lifestyle.
Well, it's interesting that as I was going through your book, and by the way, show off your book, Vanna White. You're my Vanna White today. You got to show off your book. There you go. Look at that. That's like a Bible. That is as big as a Bible. And I was going through it. I was going through the book, and one of the things that caught my attention was at the beginning of the book, you say, it's a quote from Mark Twain. You say, "It is easier to fool someone than convince them they were fooled." Ain't that the truth? So let's start with that. Some of the
Well,
things that, go ahead.
that's absolutely true. And I mean, Mark Twain has said many insightful things, but not only but for medicine, for politics, for dealing with people in general, you find that regardless of the situation you're dealing with, the one thing that almost will never occur is somebody admitting they're wrong, admitting that they were misled, and especially if they've been doing something for a long period of time, like a profession for many years,
Yes.
it's impossible to break through that wall and say, hey, look, you may have been well-meaning, but here's some additional facts that are going to change the way you do things. I mean, you get slammed right.
Yep.
It applies to medicine, it
Yep.
applies to politics, and it applies to general human interactions. So, and in medicine in particular, which is what we're talking about, that's why there's also the saying, and I won't get this precisely right, is the only way to make any significant advances in medicine is to let all the old docs die off and teach the new ones the right thing. And that, once again, is due to the fact that medicine or no other profession is ever going to embrace being told you've done it wrong for 10 years or 15 years or 20 years. Now here's the right way to do it. That just will never be embraced, no matter how true the information is.
But you know what? Science changes all the time. The discoveries happen all the time. Why would we be so married to the outcome, to the solution that we are like embracing, that we believe in, that we're teaching? Why wouldn't we be open to say, you know what? Advancements show now this is what we believed then because this is what the advancement was then, but now it is something different. Why wouldn't we just say, hey, this is science. Science moves all the time towards something different and new, things that we didn't know. Why is it so difficult then?
Let me humbly quote myself in this regard. I've said for a long time, and I actually have it in my, not this book, but my last book, is there's more politics in medicine than there is in politics. Okay. And the thing you have to remember, as you said, science is always changing, but then you have whoever your loyal opposition is say, well, I have this expert who graduated from Harvard, has published 300 papers, is a professor of medicine, and he says, this is the way it is. Well, guess what? Especially in medicine, I can find someone with equal qualifications that went to Stanford Med School, just as many publications, that says, no, the opposite is true. Mm-hmm. Well, which is why you can't throw out this crap. Well, this expert says this expert says this. You need to go to the studies themselves. And of course, not all studies are quality studies. So generally, when you're trying to put together information, you really need to accumulate it from different sources that came to the same conclusion, so that you weed out the different financial incentives or university incentives or this type of incentive, because believe me, they're all there in spades in medicine. I mean, different journals get the pharmaceuticals to support them. So it's not likely they're ever going to come out with a study that says the pharmaceuticals that are promoted by that particular company are not good for you.
Yeah.
So you need to remember that, as you said, it's evolving, it's fluid, it's dynamic, but it does not mean there is not, in different situations, a single truth. Absolutely. The thing is properly couching your terms so that you're not over asserting yourself. You're allowing for different possibilities. Like in my books and in my presentations, I always try to categorize what I present as, now this is well documented in the literature, X, Y, and Z.
Mm-hmm.
Now this is my opinion, okay? And I always try to differentiate that. But I don't think many people do that, okay? But it would be a whole lot better if they did.
Well, as I was thumbing through again, because it is a big book, and it's not something that you can read like in one sitting. You really have to absorb what you're saying so that you can maybe look at the research that you've looked at and maybe other research that's there. But there were a couple of things that I thought, I know, and I can quote you how many times you say, that with people, when it comes to eating a certain way, I would rather you eat a McDonald's, cheeseburger, whatever, than be worried about the perfect combination. But now I hear you say that there is the combination, the digestion and all that and the importance of it. Has that changed for you at all? Have you changed the way you look at gluten-free, chewing, and all these things that you talk about in your book?
No, not really. About what you were talking about there is the fact that digestion, the quality of your digestion, is really the primary determinant of how toxic your diet is. Okay.
Mm-hmm.
Now, obviously, you could eat bad food that has toxins in it, this sort of thing, obviously. But the points make is, if you eat food in such a fashion, even if it's perfect organic food, and you have poor food combinations, which is something that's discussed in the book, much of the food will rot and putrefy rather than be digested, and will allow for the proliferation of pathogens. You end up getting an abnormal microbiome. So even though you ate a perfect organic diet, you basically have a toxic gut and a leaky gut. Whereas, I use the example too, that if you eat McDonald's, but you combine everything perfectly, well, you may have the toxicity of whatever's in the food itself, but you're not going to have the added toxicity of poor digestion. And poor digestion gives you such an overwhelming toxicity that, to me, as I see it, it completely overcompensates for the fact that the food may have been of the highest quality if you don't digest it correctly.
So what is the perfect combination? What is the perfect combination?
Well, the perfect combination, the perfect combination is no combination at all. Okay. If you really want, I mean, you can have all the different foods you want. And I'm not suggesting that people do this because it's counter to the way we eat, but the way we eat is cultural. The way we eat is cultural.
Yes.
It's not designed for the best physiology. With the tribal hunters, they would eat one thing at a time. They a certain animal, or they gather certain vegetables, and then they eat what's there. When you eat them all together, you get bad combinations. But you can eat them all in the same day if you eat them separately, mono meals. However, that said, the things that go together are fats go with carbohydrates. Fats go with proteins, okay, and carbohydrates go with fats. The thing is what's the most common and worst food combination we have?
The sandwich. Yeah.
Steak and potato, bread and meat. Okay. Again, it's eating culturally, but it's not the best way to take care of your health. So, what I treat in the book is a very, very minimal coverage of food combining. There are a bunch of books out there that cover it in much more detail. And I
Mhm.
didn't really want people to get overwhelmed with that particular thing. I just wanted them to be aware of this. And if you are a
It's
person
necessary, yeah.
that's already having digestive problems, you have a lot greater ability than you think to correct those digestive problems if you start addressing not just what you eat, but how you put it together. See, the other thing too is uh, Dr. Ivan Pavlov in the early 1900s, a Nobel Prize winner in digestive physiology, did experiments with dogs where he put different substances in the dog's stomach, saw how long it took to pass.
Mhm.
That's the measure of how fast your bowel is moving. Well, when he put carbohydrates by themselves, bread, it would take 60 to 90 minutes, hour to hour and a half. Then when he put meat chips by themselves, it would take 3 to 4 hours. And when he put them together, it would take 8 to 9 hours and so you got to remember that the digestive system is a single tube. So the locomotive goes the same speed as the caboose ultimately. So you're not, one part's not going to go fast, the other part's going to go slow. So when you slow down up front by the wrong combination, you slow down everywhere, and that's when the bacteria, the bad bacteria, get a chance to proliferate, and you start to putrefy more than you digest by not keeping. I mean, you're one of your biggest parameters of health is really how frequently you have a normal bowel movement a day. I mean, you really should be having two a day. Okay, one a day, okay, one every other day, really bad.
Not good. No, no bueno, no bueno. Okay,
Yeah.
so let's go back. You say that there's only one cause of disease. We've discussed it in the classroom before, just a little bit. I want to go into that a little bit, and then I want to maybe highlight some of the things that were aha moments for you, that were game changers for you, that you may have thought one way and now you've changed your position or your opinion after reviewing the data, the new data, or whatever data that you saw. So let's start with the one and only cause of disease.
The only cause of disease, one word, toxins. That's it. And somebody says, well, what about this? What about that? That causes a problem too. Well, the point that's made there is toxins cause excess oxidation of biomolecules. Oxidation is where the biomolecules lose an electron. And when they lose the electron and they're in the oxidized state, they no longer function. So when you have different toxins that you're exposed to come in and oxidize different biomolecules at different locations at different concentrations, it's that array of biomolecule oxidation that determines the disease that you have. So the point being then is excess oxidation of biomolecules does not cause disease. It is the disease. And it's the toxins that cause that excess oxidation. And this brings in our therapeutics, which is if we can stop the toxins and bring in enough quality antioxidants to give electrons back to those oxidized biomolecules, you not only make things better, you cure it.
Okay, so you cure it. So let's talk about some of those main causes. We're talking about toxicities, toxins that cause is the root cause of all disease. But what are some of the main toxins that we willingly or unknowingly bring into our body? It's just like handing the keys to the holiest of holies and being and saying, just keep the terrorist out and you let the terrorist in. What are those terrorists in our body, which is our temple?
Well, as I outlined in the book, it's my take after going through all of this that there's three main toxin sources. Now, I let me preface this by saying somebody can tell me there's thousands of toxins out there. Yes, there are. I mean, in the air, in the food, in the water, and they all damage, but you're only getting relatively tiny amounts of each one of them, and it's impossible to effectively and practically address any one of them, except to the degree that you try to eat clean food, you try to breathe clean air, and you try to ingest avoid toxic pollutants. So having said that, the three primary sources of toxins that, as I take it, result in well over 95% of all disease on the planet are the toxins that are secondary to pathogen metabolism. Okay, that's number one. Similar to this is the toxins that come from chronic COVID, namely a persistent spike protein. That's another toxin. And number three is a pure toxin, which is a heavy metal accumulation. A lot of us have enormous amounts of mercury, lead, arsenic. I mean, what they call normal concentrations are not normal. They just don't want the whole population to panic. But yes, to the degree that which you can mobilize and get rid of a lot of heavy metal toxins, assure yourself that you don't have chronic COVID and persistent spike protein, which is a very deadly and difficult thing to diagnose because it can cause any sort of syndrome. And then number three, the one that causes, statistically speaking, the most disease at all are infections, predominantly in your mouth. And of course, we talked about this many times before. You have your infected teeth and gums and tonsils, and those secondarily cause a lot of colonization of pathogens in your nose and throat, which you swallow, and then keep your microbiome and gut abnormal with a leaky gut, so that all of this that starts here then pollutes your gut. And it's very clear in the literature that people with abnormal microbiomes, they can colonize pathogens throughout their body. We have people with Alzheimer's disease. You can colonize the oral pathogens in that Alzheimer's tissue. And same way with a lot of other things. Virtually every cancer that exists, if you actually take the cancer and the tissue surrounding the cancer and culture it, you will find pathogens. Okay, so pathogens cause cancer because they're the thing that cause the most oxidative stress, and the most oxidative stress is what ultimately causes the cancer. But addressing the mouth properly, like we said, we discussed many things more, will help you singularly more than anything else, but obviously getting rid of heavy metals that have accumulated. And oh my goodness, as many people as died from COVID, we're going to be seeing so many more die from the persistent spike protein even today. I mean, we probably have 20 million people in the United States and close to 350, 400 million people around the world with persistent spike protein, resulting in, you probably heard the term, turbo cancer. All of a sudden, people are getting cancers or sudden heart arrhythmias. You don't get heart arrhythmias for no reason at all. You get heart arrhythmias when oftentimes you've accumulated the heavy metals, but then you come along with the spike protein, which is why spike protein seems to hit the heart more than anything else.
Yeah.
It doesn't. It hits the whole body, but it seems to hit the heart more than anything else because the heart, due to its very high metabolic activity, accumulates the most toxins. Okay, so your heart preconditioned itself for an attack of another toxin like spike protein to suddenly put you into either a heart attack or heart failure or an abnormal and even fatal heart arrhythmia.
Okay. Yeah. Okay. So you talk about a lot in the book about the spike protein. And so for people that are listening to you today, and I know that you have the Super 8, so you talk about that as well. I would say give them some hope, and because in your book you say not only can you reverse you not only do you find out what that the true cause is, but you can reverse it. So let's talk about that just quickly when it comes to the spike protein.
Well, the first thing is somebody, even if you're feeling perfectly well, obviously, if you're not feeling well, you need to do this, but even if you're feeling perfectly well, you need to have one blood test for sure, and that's the D-dimer test. The D-dimer test is a direct indicator of excess blood clotting, even microclots, okay, not just big clots. And this is something that spike protein circulating in the blood reliably makes abnormal. So you could have a persistence of the spike protein at a very low level, but the D dimer should never be abnormal. Okay, there's some tests where you have a lot of leeway. The D dimer, when it gets above a certain point, indicates you're making too many blood clots in your body. And nothing could be worse than that for your long-term health, or oftentimes even your short-term health. Okay, so that needs to be done first and foremost. So if you have a normal D dimer, then great, and you feel fine, then great. However, this is important too. If you've been sick ever since you had COVID, or more commonly, ever since you've had one or more of the vaccines, you can still have chronic COVID and persistent spike protein inside the cells, but not circulating in the blood that will make that blood clotting test abnormal. So if you've really never felt well or never felt right since your vaccinations, or you've even had some conditions or had some problems, then you need to presumptively consider yourself as having chronic COVID, then go through measures to deal with that. Now, you mentioned the Super 8. That's a bunch of supplements that I put together. I really call it the Super 8 plus one, because we have another one that I add to it. And the top four, of course, are vitamin C, magnesium, vitamin D, and vitamin K, K2. These all help bring down the calcium levels inside your cells that makes all cells abnormal due to increased oxidative stress. And the other four are niacinamide, riboflavin, or vitamin B2, coenzyme Q10, and methylene blue. These four all massively upregulate ATP production, the main energy delivering molecule inside your body, throughout your body, but especially inside your brain. And this is all these things have done very, very well. And I tell you, I'm not in a position to do clinical studies and break things down, but the amount of feedback I've had on this Super 8 protocol has been enormous, and it doesn't really matter what somebody has. This is because all 8 of those supplements work to normalize vitamin C levels inside your cell. And if you're able to normalize vitamin C levels inside your cell, everything gets better, okay? Infections are suppressed or disappear, and other chronic diseases attenuate. The one that I've added now is olive leaf extract, and another supplement that works the same way as it, polycosanol, because these have been shown to help you make your own vitamin C. I mean, humans are born without, don't have the ability to make vitamin C, even though they might have as babies, but the toxicity comes in and they no longer turn the glucose in their livers into vitamin C. So when you're making your own vitamin C, everything else works better. But finally, for anyone who might have chronic COVID or think they have chronic COVID, for a couple of years now, although it's been difficult to get the word out or be properly accepted, we have now a technique. It's available at the Reardon Clinic and a few other places. There aren't many of them right now, but at the Reardon Clinic in Wichita, where you get a very simple ultraviolet blood treatment, okay? But it's different application because they withdraw some blood and they withdraw some oxygen and put 2 syringes at either end of a tube, and then put that tube inside the ultraviolet machine, turn it on, and go back and forth, back and forth, back and forth with the oxygen in the blood and the ultraviolet light. And then after about 1.5 to 2 minutes, after the blood gets super bright red, then re-inject that blood back into the patient. Also, it's very important to note, this is not just any ultraviolet machine. It's one that has a single wavelength, 254 nanometers, whereas most ultraviolet machines are broad spectrum. Well, as I like to say, you know, you can take a multivitamin, multimineral, and you get a lot of different things, but you don't get much of anything, okay? So this is the wavelength you need. You don't need it to be one of countless wavelengths, but this one wavelength. Now, Why does this work? I can't really tell you. But I mean, I can't tell you why a lot of wonderful things like ozone works so well. Although this, for this application, this works better than ozone. And believe me, I love ozone and it does some magnificent different things. But uh, the person who devised this in Switzerland, he's treated over 100 different patients, and over 95% have been completely cured, clinically
Mm,
cured.
wow.
What's even with anywhere between 1 and 3 treatments, each treatment takes about 15 minutes. So do it once, come back in a week, come back in a week. And what's even more impressive is in the patients with chronic COVID, that's what we're talking about, chronic COVID patients, long haul COVID, the ones that did have elevated D dimer levels, those D dimer levels rapidly dropped to normal.
Wow. Wow.
Okay.
That's
So
amazing.
I'm talking about something that not only can cure and has cured chronic COVID, it's going to make so many other treatments better
You know, I would
because
love to have Dr. Honeyhacky back in the classroom. He's been in the classroom once, so we'll reach out to him again. But it is amazing the things that they're doing there. Even before, I remember they were taking patients outside their clinic at the beginning of when people didn't really know what was happening, and they were doing the IVs and people were getting better. I have total respect for Dr. Honeyhacky, and I would love for him to come back and share about this. And I'm glad to hear that you had mentioned about this blood ultraviolet radiation with the oxygen and many years ago. So I'm glad that it's come to fruition and it's being used,
that's
especially in
right.
the
2 years
Reardon.
ago, 2 years, two and a
Yeah.
half years
Yeah.
has been
I wanted to interview him, remember? And he just won't come out. He won't come out and play. But at least now his work is being used in at the Reardon Clinic. And so with that in mind, Dr. Levy, so there is hope for people because there's two extremes because you also talk about shedding in the book. You talk about shedding, and that's something I don't even want to think about. That the possibility of someone who had gotten the jab, the shot, standing next to me, and I don't know if I told you about this. I think I
But
did.
that's what also makes this technique so phenomenal. It's a very simple technique. Well, I mean, it'll be up to the doctor what they want to charge, but it probably shouldn't be more than a $70 to $100 treatment. Very quick, very easy, and it can be redone as needed. So if you do feel that you're very sensitive, or you have some people that, like you've talked about in the past, you've hugged and
Yeah,
then
I'm a
didn't feel so
hugger.
well. You don't have to sit there and worry about whether or not something's getting hold. You just get a hold of your
Yeah.
doc that obviously has this device, get your treatment, and you're
And what
ready to
is the
go
name
again.
of the device? Because not everybody can go to the Reardon Clinic, maybe, but so what is the device called? Does it have a name? And
It's a machine from Germany. The Germany company is Hansler, and the details are in the book. Okay,
yes.
and I think contact information for a practitioner who is interested in ordering one is in the book as well.
Perfect. And so show the book again. Once again, I want to remind all of you that 26 of you, because I know everybody loves Dr. Levy, and this includes you BitChute people. You need to email me if you want 26 of you will get a copy, a PDF copy of his latest book, which is like the Bible. I'm telling you, it's for if you want to be well. This is where you need to go. I'm just so excited that Dr. Levy is a regular teacher in the classroom. I've learned so much with him through the years. I think it's only been like 5 or 6 years that he's been coming in the classroom, but boy, have I changed the way I perceive magnesium and vitamin C as much as vitamin C that I did, but also hydrogen peroxide. I'm sure we're going to switch to this topic in a little bit, but there's so much that we can control. And if you're fearful about your health, that's going to create a different kind of pathogen. That's going to create a different kind of toxin in your body. So I want you to feel empowered as you listen to this today and know that you can do the Super 8 plus 1. You can, figure out where to get your blood fixed and irradiated. I don't know the proper terminology, but it's more than ultraviolet. There's oxygen as well. but just please just do something and stop being fearful, because if you do nothing, then what do you expect? So I want to encourage you to empower yourself. Go to whenyounneedafriend.com. While you're there, please subscribe to the website, like and follow me on all social media. And please share this video with your friends. Share this video with everybody, because you probably know someone who has been experiencing exhaustion after the COVID pandemic. And so let's work together. Let's help each other heal. Go to the website to also look at the Lilly approved products. Make sure that, whether it's, beauty products, or you want to go all in and heal your body with, whatever it is that you want to choose, please go there and it'll help the classroom grow. And if you want to become a student in the classroom, whether it's your time, your talent, your treasure, we encourage you to please be a part. Put your thumbprint in the classroom. As I mentioned earlier this year, we lost during the winter break, we lost a couple of sponsors and or donors, and we just want to encourage all of you that if you want to give up one of your frappuccinos a week and or a month, just donate to the classroom. Is all appreciated, whether it's your time, your talent, and mostly your treasure. We would appreciate all of that as well. Today we have Dr. Thomas Levy in the classroom. He is one of my favorite teachers in the classroom. You can find him at tomlevymd.com. His latest book, we're giving away 26. Go ahead, show me the book. Show me the book. There we go. That's how you do it. This book, 26 of you will get the PDF copy. You have to email me at lily@whenyounneedafriend.com if you want a copy. I will reply back with a copy for you. And if you want the hard copy, you can go to tomlevymd.com, and there you can click on the book and get it at, I think it's Foxfire. It'll take you to that link. And so, Dr. Levy, I know you have a couple of events that people can come see you. Is this the March and the April event? Are those anybody can come to them, or do you have to be a member of the association you're speaking to?
I don't know that you need to be a member, but they are dental medical conferences, and they have an admission fee. I don't know the structure.
Okay. But one of them is what, in March, and the other one is in April, correct?
Right, correct.
Perfect. So check out Dr. Levy's website at tomlevymd.com and see if you can. Are you going to have your ticket sales there or no?
No, I'm just going to be at the conferences. I have nothing to do with putting on the conferences
Correct.
or
Okay,
dealing with
so
any
one of them is IAOMT is the one
.org.
of the conference, and the other one is IABDM.
Right.
Okay, so check it out if you're interested. Also, Dr. Levy has two of his wonderful videos that we recorded. One of them is for practitioners, which is optimal treatment of disease. This is your protocols, and when you complete the course, you get a certification by Dr. Thomas Levy saying that they are certified to and understand the protocols. And the other one is a roadmap to health, which is for people like you and me to understand a little bit more of how to reverse dis-ease. Dr. Levy, I'm so grateful to you that you're here today. I wish I could freeze time. One of the questions I asked you before, because I want everybody to get the book, but one of the questions that I asked you is, were there aha moments as you were writing this book that you had to change the way you believed or your opinion about something, and what were they?
Probably the major aha moment was the nature of antioxidants and the impact that they have clinically. I mean, for all except about the last year and a half since writing the book, is uh, we talk about oxidation, biomolecules losing electrons, and that vitamin C and other anti-quality antioxidants can donate an electron back to the biomolecule and restore it to the normal reduced state. And I always felt, and I think it's the opinion of everybody else, okay, especially those that sell supplements, is that if the antioxidant is in an oxidized state, in an electron depleted state, not only will it not help you, but it might hurt you because it needs to take up an electron to get back to the normal state. Well, as it turns out, and I'll explain why, that's absolutely and totally wrong. The thing is antioxidants, whether it's vitamin C or not, they are not the provider of the electrons. They're the distributor of the electrons. Okay, so their purpose is not to bring new electrons in, but to spread far and wide enough throughout your tissues so that the new electrons you take in from a quality diet get properly distributed by the oxidation reduction flow of electrons and electricity in your body. And this was documented and proved in the literature that showed that oxidized vitamin C, electron depleted vitamin C, was as or more effective than regular vitamin C in bringing animals, minimizing the damage that animals got from neurological disorders causing a stroke, this sort of thing, animal studies. That also showed another prominent antioxidant, methylene blue. Well, when it's blue, when it's called methylene blue, it's in the oxidized state. Yet they've shown that giving this oxidized substance, methylene blue, has repeatedly been able to bring people out of septic shock and septic shock advanced even after they had coded. So the point again is, yes, these are dramatic elements. The other thing too is coenzyme Q10. Coenzyme Q10 comes as ubiquinone, which is oxidized, and ubiquinol, which is reduced. They both work just fine. The thing is the supplement companies don't realize this. So you're still, and it's fine. There's nothing wrong with getting an antioxidant that has a few more electrons in it than the other one. But the point is if you have a widget company and you have 1,000 widgets, but you only have 2 distribution trucks, you're not going to get very many widgets where you need it to go. But if you have 1,000 widgets and 50 distribution trucks, then you get it out there. And it's the same thing. The widgets are the electrons coming in from nutrition, and the distribution trucks are the vitamin C. You need them both because electron flow is life.
I love it. I just want to pause and just let that resonate. Let that resonate. Dr. Levy, hydrogen peroxide, in your research, did you feel this is the best kept secret for a lot of people don't know it? I remember the first time you spoke at one of my summits, I would say probably 80% of the people there went and got their own their nebulizers because of nebulizing hydrogen peroxide. And I wish I had $1 for every person who said, "Oh, hydrogen peroxide, that's so dangerous. Why would you inhale it?" So let's talk about the benefits and how does hydrogen peroxide play the part in reversing disease?
Well, first and foremost, it's important to realize the structure of hydrogen peroxide. You have oxygen, O2, you have water, H2O, and you have hydrogen peroxide, H2O2. So, I mean, it's as natural a molecule in your body as you're going to find. And in fact, a very large amount of every breath that you take, the oxygen that you take in, is converted into hydrogen peroxide inside your cells, inside and around your cells. The thing is hydrogen peroxide doesn't become activated as an oxidant until certain conditions are met, usually dictated by whether or not an infection is lowering the pH and lowering the oxygen level inside a tissue. So the point being is hydrogen peroxide inside your body is your natural antibiotic. It's the most single important thing that your body makes and utilizes to kill pathogens and resolve infections, regardless of everything else that you're doing. In fact, every time you take a breath and you breathe in air that has some pathogens in it, and pretty much every breath you take has pathogens in it, it's a natural response of the cells lining your lung airways to secrete and express hydrogen peroxide into the airspace. So it's your body's natural antibiotic, it's your natural defense. And so when you get a real significant infection that you're not getting over because you had too big an exposure or your immune system was too low, then all you're doing with hydrogen peroxide by nebulization, or sometimes orally, or sometimes gargling, whatever application we're talking about, is you're just augmenting the body's natural defense. The body fell short in the amount of hydrogen peroxide it needed to deal with it, and you're bringing in the extra that it needs to resolve the situation. And in the case of the hydrogen peroxide nebulization, uh, not a formal scientific study, but a very significant to realize that a friend of mine got a nebulizer and hydrogen peroxide in Colombia, South America, early on in the pandemic. For a number of reasons. She had a cold and it got her over a cold quick. And I was leaving. She said, "Can't you leave the nebulizer?" I said, "Sure." And over the course of the next 9 months, in her small, poor barrio, she came across 20 of her fellow Colombians that had not minimal, but advanced COVID. By advanced, I mean, if you remember, very early on in the pandemic, all of the COVID was severe shortness of breath as well. That's why everybody's getting slapped on the respirators and you had so much sudden death. Well, all 20 of these patients, individuals, had severe shortness of breath. So, in my opinion, just on that basis alone, they were close to succumbing. All right. All 20 using peroxide nebulization alone. No vitamin C, no vitamin D, no ivermectin, no nothing. They were completely cured in 5 days with just hydrogen peroxide nebulization. Now, I just say that to show the power of the peroxide nebulization. I would never tell somebody, do the nebulization and nothing else. I say, do the nebulization, take your C, take your D, take everything else you can find. But that's not available to poor people in a lot of areas of the world. So to me, that was the really singular, potent way to show the power of peroxide. Now, one thing I want to talk about directly relates to hydrogen peroxide. And we talked a little bit earlier about the abnormal gut, and we talked about the infections in the mouth. Well, there are two things that if you do not have infected teeth, you don't have a root canal, you don't have an infected tooth, and you never did, so you know the tonsils are in good shape. So in other words, if you have a mouth that is not yet infected, doing daily water pick irrigation with water and a little bit of hydrogen peroxide will just about prevent you from having any significant disease in the future. Why do I say that? I say that because all the infections in the mouth start from deep-seated infections in the gum. So if you're able to just each day kill all the pathogens that are just starting to incubate in the gums, you will never, until you just get old enough that your teeth break down and maybe admit pathogens by some other way, you will stay healthy. Because not only does this then keep the mouth healthy, but then you don't have any of the chronic pathogen colonization that you swallow to make the gut abnormal. So if you do this on a daily basis, and then maybe once every week or two, do a peroxide nebulization, as long as your bowels are normal, if you're having good normal bowel movements and you're doing this water pick with the hydrogen peroxide, those are the two single most important and least expensive things you can do to give yourself long-term health.
Yes, and you're talking about 3%. You don't need to do the food grade unless you want to do
No.
the food grade. 3%, and you can dilute it if it's too much. What can you dilute it with? Is it like salt water, saline
Salt
water?
water,
You don't want to
water,
do tap. You don't want to do tap water, especially if their tap water
not
is
tap
not
water,
good.
but
Yeah.
water or saline.
Water or
Water or
saline.
saline.
Yes, very good. Okay, Dr. Levy, we're coming down to the last 5 minutes. This has been the fastest hour in the classroom, as always. So, is there anything else? Because I know that in the past we've talked about, and people can go back to whenyouneedafriend.com or to the YouTube channel, whatever channel. I have a playlist for Dr. Levy. And some of them are just like recaps in YouTube, but if you want to watch the whole thing, you'll find it at BitChute. But we've talked about cardiac health and the importance of magnesium. We talked about health in general and the importance of not using calcium, iron, and copper. So in these last 3 minutes here, can you encapsulate the reason why magnesium is important, especially for people that have heart conditions? Just bring it all together.
Sure. In a nutshell, it's not clear to me exactly why this is true physiologically, but all sick cells, by sick, I mean lots of oxidized biomolecules, so the oxidative stress is elevated inside the cell. This is always associated with, accompanied by, and caused by elevated calcium levels inside the cell. And as long as those levels of calcium stay elevated, you will never have a normal cell. You will never resolve the oxidative stress. And whatever disease you have will continue to go on unabated. Now, there are a lot of things that can affect this calcium, like vitamin C and vitamin D, vitamin K2. But the big one is magnesium. Okay. The more magnesium you get inside your cell, the more calcium you push out. You can't have elevated levels of both because they're natural antagonists. So take in your magnesium, get that level up, the calcium drops down, and then vitamin C is free to come in much easier. And then as the oxidative stress goes down, the enzymes in your cell start making more glutathione and everything gets better. So you never want to supplement calcium. You never want to take calcium. You don't want to have excess dairy. Okay. I'm not saying you have to eliminate dairy, but no excess dairy. And certainly never use milk as a beverage. Okay. That's just way, way out there. Also avoid Rolaids and Tums because the high amounts of calcium in them, they're great at relieving stomach upset, no doubt about it, which is why people get addicted to them and then have another huge source of calcium they're taking in on a regular basis. And although oxidative stress is at the heart of all heart disease, no pun intended, okay, the calcium is one of the players that accumulate in the plaque as well. So all this, the more calcium you take in, the higher your incidence of heart disease and cancer clear across the board. The other two things you mentioned, the iron and the copper.
Yes.
Iron and copper are transition metals that you have in relatively tiny amounts in your body, and they recycle. Most nutrients and nutrient substances, you take them in, they're water soluble, they do a job, and you excrete them. Take them in. So you need to keep on taking a bunch in on a regular basis. When you have something that you have it in small amounts and it recycles, you don't want to be taking in a lot of it on a regular basis, certainly not by supplementation and not by the wrong selection of foods, because they start to accumulate. Nothing will increase the oxidative stress inside your cells more quickly and more rapidly than increasing your levels of iron and increasing your levels of copper. And when people, there are a lot of people out there that are just in love with copper, all I can tell you is the studies that mean the most, these are called all-cause mortality studies, which means if you're doing this, do you have a greater chance of dying and from anything? And the more copper you take, the greater your chances of dying from anything. All-cause mortality study. Forget all the other studies that talk about the interaction at the enzyme levels. If you take in more and you die sooner, that's not something you want to do.
Not a good combination. And the importance of magnesium. I remember you teaching me that 85% of everybody who has a heart condition, problems with, that they are deficient. 85% of people that have heart conditions. Can you elaborate on that? I butchered
Well, I
I
put it
butchered
even
up.
higher than that. Well, the thing is if you have any medical condition at all, you have elevated calcium inside your cells and you have not taken in enough magnesium to deal with it. So really, except for the 100% healthy person, you're magnesium deficient. It's just a matter of degree. And most of our magnesium supplementation, unfortunately, because of the toxic world we live in, is designed to minimize your degree of deficiency. I mean, it's sort of a sad way to approach supplementation, but that's what we're forced to do with magnesium because it's directly correlated to the toxins that we take in, and there's no indication anytime soon, if ever, we're going to actually start decreasing our daily toxin exposure from air, food, and water.
Yeah. And you basically that every time that I've been around you, magnesium chloride is the magnesium you recommend. Is that specifically for the heart, or is that, that is that a general magnesium? Because you're the only one that I hear talk about chloride, magnesium
Well,
chloride.
the thing is people are taking magnesium because they want to get magnesium inside their body, and all the magnesium supplements do that.
Hmm.
But all the magnesium supplements are an anion and a cation: magnesium chloride, magnesium sulfate, magnesium glycinate. And the cation is the magnesium, that's what you want. But the anions, they all do different things. So you need to do your due diligence and your research and decide what additional effect do I want to get from the anion. And in the case of the chloride, the magnesium chloride, by itself, back in the day in France, about the same time that Dr. Klenner cured polio with vitamin C, Dr. Nouveau cured multiple cases of polio with oral magnesium chloride solution alone.
Mhm.
And so the whole point is, and there's a lot of other studies that show the anti-pathogen effect of magnesium chloride, but it's not shared by all the other magnesium forms. With magnesium sulfate, for example, when they did culture studies of a virus, they showed that magnesium chloride killed the virus and magnesium sulfate encouraged the virus growth. Okay, so there can be big differences in what the anion is doing to the overall health effects. So that's why they're all good. I mean, there's nothing wrong with magnesium sulfate either. That was a test tube study,
Hmm.
not a study inside the body. But if you can get your magnesium, which you want, in as high amounts as possible, and get an additional good benefit of the iron, that's what you want. And so in the setting of the pandemic and whatever future things are going to where they're going to shovel at us,
Yeah, you're just hearing about it now too.
that's a particularly good form of magnesium to take, I
Very
believe.
good. Well, Dr. Levy, it is the fastest time. I wish we had another hour ahead, so maybe we can get you back sooner than once every other month or whatever. We can get you back again because this topic we just need to like hone in on one. There's so many things. So thank you so much you could have been anywhere else, but you chose to be here with me and all of us. So thank you so much, Dr. Levy.
My pleasure, Lily.
And once again, as a reminder, if you want a copy of the book Dr. Levy has in his beautiful hands, there you go. You can just email me at lily@whenyouneedafriend.com and request your free copy. Be one of the 26 to get it for 2026. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Thomas Levy wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.